Hi, I'm Geraldine, and in this video, we will cover the most essential infection control practices you'll use every shift. I will walk you through the key concepts and skills that protect you, your patients, and everyone around you. By the end of this session, you will be able to, number 1, explain the chain of infection and how each link contributes to disease transmission. Number 2, describe effective strategies to break the chain of infection in clinical practice. Number 3, demonstrate proper hand hygiene. Number 4, discuss the principles of standard precautions and their importance in infection prevention. And number 5, apply standard precautions, including the correct use of personal protective equipment in routine nursing care. To prevent and control infection, first, we need to understand how infections spread through the chain of infection. The chain of infection is made up of 6 different links. Infection occurs when each link is present in this order, but the chain is easy to break. Each link can be broken, which prevents disease and keeps patients safe. Let's go through each link. An infectious agent is an organism having the ability to cause disease. To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified. The second link is reservoir. A reservoir is where pathogens can thrive and reproduce, like tabletops and doorknobs and people. Break this link by washing your hands, keeping a clean environment and disinfecting. Next in the chain is the portal of exit, which is how the pathogen leaves the reservoir, such as sneezes or coughs. Break this link by wearing personal protective equipment, washing your hands, properly disposing of trash, and covering your coughs or sneeze. The fourth link is the mode of transmission. This is how pathogens are carried from one place to another, even in the hands of a healthcare worker. To break this link, wash your hands, control airflow in negative pressure rooms, disinfect surfaces, handle food properly, and observe isolation precautions. Next, the chain includes the portal of entry. It's the way pathogens enter the host like breaks in the skin. Healthcare workers break this link by practicing aseptic technique during procedures, taking care of wounds, washing their hands, and properly caring. The last link in the chain of infection is the susceptible host. The host is a person who cannot defend pathogens such as elderly or burn patients. Healthcare workers break this link by treating their primary disease and identifying those at higher risk for infection. As a healthcare provider, you can see how your daily duties give you many chances to break the chain and keep everyone safe from infection. Standard precautions are infection control guidelines that are used in hospitals to reduce the spread of pathogens between patients and healthcare workers. These include protection from blood, body fluids, non-intact skin, and mucous membranes. Standard precautions are a set of infection control guidelines designed to reduce the transmission of harmful microorganisms. By adhering to these guidelines, healthcare professionals can help protect themselves, their patients, the general public from diseases. The primary component of standard precaution includes 1. Hand hygiene, 2. Personal protective equipment, 3. Patient care equipment, 4. Needle stick and sharps injury prevention, and 5. Patient placement. Hand hygiene is perhaps the most important aspect of standard precautions. Healthcare workers must clean their hands before and after every patient interaction, as well as after any contact with blood, body fluids, or contaminated surfaces. Alcohol-based hand sanitizers are typically used for routine hand hygiene, while soap and water must be used when hands are visibly dirty or contaminated. Personal protective equipment is another key component of standard precautions. These include items such as gloves, gowns, masks, face shields, and eye protection. Healthcare workers must use PPE when they are in close contact with patients or when they are performing any procedures that could expose them to blood or body fluids. For example, clean gloves must be worn between tasks and procedures, and they must be changed if they become contaminated. Mask, eye protection, and face shields must also be worn when performing certain procedures to prevent sprays and splashes of body fluids from contacting the mucous membranes of the eyes, nose, or mouth. Gowns must be worn when contact with blood or body fluids is likely to prevent soiling of clothing during patient care procedures. If the gown is contaminated, it must be removed and replaced with a clean one. All patient care equipment must be cleaned and disinfected between patients to prevent the spread of infection. This includes items such as stethoscopes, pulse oximeter, blood pressure cuffs, and thermometers. Reusable equipment should not be used on another patient until it has been properly cleaned and disinfected. Single-use equipment such as small volume nebulizers must be disposed of after each use. All healthcare workers must be cautious when handling needles and other sharp objects to prevent accidental needle stick injuries. This includes using proper disposal techniques and wearing gloves when handling sharp objects. All disposable syringes and sharp objects must be placed in puncture-resistant container for disposal. In some cases, patients with certain infectious diseases may need to be isolated in private room to prevent the spread of infection. Contact precautions which require the use of gloves, gowns when entering the room may also be necessary. Airborne precaution which involve using N95 mask and negative pressure rooms must be used for patients with airborne infections. Standard precautions are a key part of infection control and play an important role in preventing the spread of disease. Next, let's have a recap with the hand washing steps. Wet hands with water. Step 1. Apply enough soap to cover all hand surfaces. Step 2. Rub hands palm to palm. Step 3. Right palm over left dorsum with interlaced fingers and vice versa. Step 4. Palm to palm with fingers interlaced. Step 5. Backs of fingers to opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasp in right palm and vice versa. Step 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Step 8. Rinse hands with water. Step 9. Dry hands thoroughly with a single use of towel. And step 10. Use towel to turn off faucet. That brings us to the end of our teaching session on infection control. As newly hired nurses, you are now part of the first line of defense in preventing the spread of infection within the healthcare facility. The principles we've discussed today, like the hand hygiene, use of personal protective equipment, proper disposal of waste, environmental cleanliness, and adherence to standard precautions are not just policies. Infection control is everyone's responsibility. Every patient encounter is an opportunity to protect life, not just the patient's but yours, your colleagues, and your loved ones as well. Let's always remember, the best infection is the one that never happens. I encourage each of you to be vigilant, to ask questions when unsure, and to serve as role models for safe and clean care. Let infection control be a daily habit, not just a policy to comply. Thank you for your time and your attention, and most importantly, your commitment to safe nursing practice. Let's work together to create a culture of safety and excellence.